Dr. Alan Gaveck, CEO of Cellular Science. I'm honored today to have with me Dr. John Young from Young Foundational Health Center in Largo, Florida. Welcome, John.
Thanks for having me.
Wanted to have John with us here today so we could discuss a couple of topics that are fairly near and dear to our heart. I'm going to talk a little bit about autism, but Dr. Young, go ahead. Tell us about some of your experience with Down syndrome.
Downs is the big one for me. 5 years ago, wife and I expecting our fourth child. Everything's fine. And then little Catherine pops out and send her down to All Children's Hospital. And then they tell us that she has full-blown Downs. And that maybe, John, you can get these programs from the state and then special education, and then she'll be sick all the time and antibiotics. And that's what they told us. And Karen and I said, that may be fine for others, but for our child, that's not good enough. And so I started to do a lot of research, and I said, all right, we're going to experiment with Catherine. And so the first thing we did is we rebuilt her immune system. Down's kids, they're in the doctor's office at least once a month with some type of ear infection. We rebuilt her immune system. A lot of vitamin D, a lot of protein. She's never had sugar. And she has never had an antibiotic, never had an ear infection. And her immune system is really, really strong. Now, the immune system's great. What about mentally? And that's where, we noticed that she was delayed in her speech.
Right.
And I started reading about Niehaus in Germany back in the 70s and 80s, doing some interesting things with sheep stem cells. Mm-hmm. And in fact, one of my patients, her daughter is a Down's patient and was given this treatment in Germany years ago, from 2 years of age to 12. And she's been in the office, and it's like talking to a university student.
Wow.
You can remake the brain. Now, we don't have sheep stem cells. We aren't using them here.
Correct.
So in talking with you and some others, we decided to use umbilical cord stem cells. And it's very interesting. Last July, she got her first IV of stem cells. Just straight IV. We used mannitol first to help cross the blood-brain barrier.
Right.
And the teachers at her previous school said Catherine has very good social skills, but just really not educatable material. We take her over to another school, and the teacher says, I have no idea where they came up with that report.
This was after you'd given stem cells,
After we'd
right?
given stem cells.
Right.
Said, tremendous potential, loves to learn, and even our friends would come over and say, man, she is talking more, she's really more alert, and it's really been interesting. She's getting ready for some more stem cells here in the next week. But just to see that doing that, people, we can see it, but others are saying, hey, wait, there's something different about Catherine. And it's not that I'm so smart, it's just that I'm taking the old information and let's modernize it a little bit. And it really comes back to you can rebuild these people. You can rebuild a lot of people, but it's very important for us because of our daughter.
Correct. How many infusions has she had?
She's had one, and we do it about every 4 months.
Every 3-4 months?
Yes.
Okay.
So she's coming up our next one, and that's just what we're going to be doing for the next probably 5-6 years.
As long as you see progress, you'll continue down that road.
And that's what Karen and I have said. As long as she's moving forward, she keeps getting these.
Exactly. Well, a different condition, but yet still childhood that we see a lot is autism. And autism is now known to be an autoimmune disorder of the gastrointestinal tract. So it made sense to start with stem cells because there's some vector. Of course, some people believe it's the vaccinations from the child and all these different things. We won't just discuss those facts, but
Not today.
That's a heated subject. But with the autoimmune disorder of the gastrointestinal tract, they now do not produce the correct enzymes to correctly form the temporal lobes of the brain, the amygdala and the hippocampus, which eventually lead to the limbic system, which is the emotional outburst system in our body, the emotional system in our body. So we have been treating children with autism simply by giving them stem cells, low dose, but frequently and over a long period of time, in order to, number one, balance that immune system, because we know stem cells have that great capability to balance the immune system. With the GI tract on an immune compromised child now functioning correctly, they begin to produce those correct enzymes that help the brain. However, the brain damage is still there in the temporal lobes. So by using the stem cells, they do cross the blood-brain barrier in a certain amount, and using mannitol, you can increase that cross of the blood-brain barrier. And we see from psychologists, we see from teachers, and we see some parents similar things that you see. Teachers and psychologists and parents say, wow, we cannot believe the growth in this child over the last 3 or 4 months compared to what we've seen in the first 5 or 6 years of their life. So I don't think you nor I want to blow it up and say, you know, this is a big cure and it's a big cure-all for everything. But the bottom line is, we know what the disease process is. We know the potential of the cell. If we can work these together, along with integrative medicine, to just build up the entire system, we have a potential to help these kids in life to potentially be as much as they could possibly be.
See, now, that's what I like what you're doing with cellular science, is you're saying, all right, there's things out there, and you can do, you know, do what your doctor says and all that. But there may be some people out there saying, all right, that's fine, but I think there's got to be something more.
I want more.
And that's what really my practice is involved in. People are saying, wait, there's got to be something more. And you're right, it's not a cure-all, but boy, it has made some big differences in your patients and my patients.
Well, I'm excited to hear more progress on beautiful Catherine, and we'll get together, we'll talk again. Thank you very much.